Well, because November is Men's Mental Health Awareness Month, it just happened. The whole Movember movement was happening. I really wanted to focus this episode on men's mental health and talk about it in a lot of different ways. But first up, I have an expert on with me, Dr. Audra. And Dr. Audra, you are a psychotherapist, but also you kind of focus heavily on men's mental health. How are you? How you doing?
I'm great. I'm so good. I'm so happy to be here and excited to talk more about my passion.
Yes. Okay. So men's mental health. This is kind of, I don't know if you specialize in it, but it's definitely your focus. So break down for me why
Yes.
you chose to focus on this one.
Well, I will be honest with you, it chose me. And I think that a lot of therapists can relate to this. Like when you're going into this work, wanting to be wholehearted and authentic in the work that you're doing, your clients choose your specialty chooses you if you're allowing that to be in alignment for yourself. And so I did not set out to become a therapist for men, to specialize in men's mental health. My dissertation was on eating disorder prevention in a data pool of women. And so I was about as far from this area of specialization as you can get. But when I started my full time clinical training, my internship year and my postdoc year, I was working at a university counseling center. And so I was seeing a lot of 18 to 25-year-old clients coming in. And I think part of the blessing of that is a lot of Gen Z clients were coming in. And so a lot more men, a lot more Gen Z men were coming in for therapy. And I was just naturally, randomly getting assigned these clients to my caseload. And come to find out, it just felt like the perfect fit. I am a more direct therapist. I don't have a very like overly soft or feminine energy. I think I am like, call it like it is. Can I swear or should I not swear?
You can totally swear. If that feels comfortable for you and feels right, go for it.
Okay. Okay, cool. It does. So I'm gonna like call bullshit. I'm gonna say it how it is. Like I'm not going to be like overly cautious in that sense. And so I just felt like that was a good fit for a lot of the men I was working with. Like they were coming in wanting someone who wasn't gonna sugarcoat it, who wasn't gonna just give them like empty affirmations, but was going to validate what they were going through and then help them recognize like, okay, now that I understand it, what do I do with it? How do I change? Give me something tangible that I can actually do. And so that's such my style. It's what I've sought out for my own therapy transparently. And so it's just naturally what I brought to the room. And it just happened to be a great fit for men. And so over time, it just became an area that I leaned into while I was working at a university counseling center. I co ran a men's support group. I was just taking on more and more of these clients. And then every place I've worked since, it became really like the in house all my colleagues knew, okay, these are the clients Audra loves to work with. Well, Audra loves working with men who have never been to therapy, who who are really skeptical about therapy, like the tough nut to crack, like send my way. I'm up for the challenge. And then we are today at this, and then started really publicly and forwardly presenting and marketing myself as a therapist for men. This is the work I've been doing for 10 years behind closed doors, one on one with clients. But over the last 2 years, I've become a lot more public with not just the work that I'm doing, but advocacy around it. And so that is how you and I ended up even finding each other, is that now I've built a presence for myself on social media and have had really great opportunities to speak about men's mental health and advocate for men's mental health outside of the one-on-one private confidential relationships I have with my clients.
Well, and you just mentioned it, how I found you on social media, which was so awesome. But what I found as I was searching for you was there's one, not a lot of male therapists, and there's not a lot of therapists who
Mm-mm,
focus on men's mental health. So I was really struggling to
no.
find an expert in this field. And then I got lucky and stumbled upon some of your videos. And I was like, okay, this is perfect. But I was sitting there, I was like, dang, are people going to get mad at me because I'm talking about men's mental health? And I have both women on this episode, but it was so hard to find any type of resources on this particular topic. So can you speak to that a little bit?
Absolutely. I mean, I I talk all the time about how, my area of specialization, my expertise is in therapy for men, men's mental health. But if we think about it, that's not a niche. That's not a specialization. That's half of the population. And yet it is so rare for that area of expertise to exist in the field of psychology or therapy specifically, that it is a unicorn of sorts. And then being a woman therapist for men, of the other therapists, thankfully over the last few years, I've met a lot more therapists who do love this work, but many of them don't market themselves this way. It's a little bit more common to find a male therapist who talks on their website about working with other men, but you would be hard pressed to find many other female therapists who specifically identify men as a population they work with on their website. And so I think this is one of the problems, is that especially right now, there's so much conversation around mental health and personal growth and therapy. We're working so hard to normalize it and destigmatize therapy. Men in particular are really, I think, being challenged right now to like go and become more emotionally intelligent, like get in touch with that, grow, work on yourself. You deserve this. Go to therapy, right? Like we're encouraging that. Okay. But then they go to look for a therapist, they're going to have a hell of a time finding someone who they feel, I would argue, feel comfortable going to. Now, you and I, for example, like I've been in therapy myself. I think as a therapist, it's really important that you understand what it feels like to sit in the other chair. And I just value it as a form of self-care myself. For myself, when I'm looking for a therapist, I could identify 10 probably random criteria. I could see I want to work with a woman. I want her to be married. I want her to have kids. I want her to specialize in anxiety. I want her to have gone to school on the East Coast. I want her to have blonde hair. Like I could identify so many different criteria and find probably 45 therapists in my metropolitan area who I could
Yep.
work with.
Yep. Same for me. I mean, I
You're
started seeing a
a
new
man
one and
looking
it
for
was
a
easy.
therapist, you're going to be exactly. Yes. You swing a bat and you find a new therapist who's a great fit, right? And on the contrary, you're a man looking for, and I'm going to talk in a lot of generalizations today. So like, I'm not talking about all men's experiences. I'm not talking about all men who are looking for therapists. Like everyone's going to be unique. I'm going to really speak generally, but by and large, you look for a therapist as a man, you're going to find a lot of women who have a lot of therapists are largely women. It's a female saturated, female dominated field. And so you're not going to find, if you're looking for a male therapist, you're going to have a harder time finding that. And then you have all these female therapists who are not listing men or men specific issues on their websites. And you've got these, just even talking about the marketing, you've got these websites that are like no fault to the therapist, but very feminine, very flowery, very calm, pretty colors, right? It's not necessarily creating a space that feels masculine or welcoming of men. And so therapy already for anyone can be such a vulnerable thing to put ourselves into. It's a risk for a lot of us to say like, okay, I'm going to ask for help. And then we're expecting men or hoping men and challenging and encouraging men, really, tasking men like, yeah, go to therapy and do this vulnerable thing, but it's going to be an even bigger risk because you're going to have a really hard time finding a therapist who is going to make it clear on the website that they're there to help you.
So then take it a step
Clearly, I
further.
have like a soapbox that I like existing on here.
Nope, I love it because this is what you're an expert on. This is what you specialize in. This is why you're here. I want to take that a step further because say you're a male and you did finally find a therapist, right? And you're like, okay, this could be a
Yeah.
fit for me.
Yep.
But then taking that a step
Yeah.
further is they feel uncomfortable to do so. Why do you feel it has been
Yes.
generally harder for men to get into
Yeah.
therapy?
Generally, I think we expect men to be hyper independent. They're problem solvers. There's the trope around the lone wolf, like you can do it on your own. You can figure it out. And you are the provider, you are the protector. Like there are all these, and even if these are stereotypes, they are really powerful expectations that still exist in our society. And they are powerful expectations that some men really hold true. Like there are a lot of men that feel really proud of that traditional masculinity. There are a lot of women who look to men who want their men, like want men to uphold that real traditional masculinity. There are men who maybe feel in conflict with it, but regardless, there's an expectation. And so we're essentially asking men to set aside everything that society has asked them to be, right? Like you're a little boy, boys don't cry, suck it up, be a man, don't cry. I'll give you something to cry about. Like I have men who are commenting on my videos on TikTok and sending me DMs all the time, sharing the experiences they had at ages as young as 4, 5, or 6, where they learned, oh, I'm too old to cry now.
Mm.
And so when you learn that young that you're not supposed to have those sorts of emotions, that you're supposed to figure it out on your own, man up. And then we expect them decades later to feel super comfortable walking in and asking for help. There's just such a discrepancy there between what we generally expect men to be and then what the experience and process of asking for help and going to therapy usually is.
So being someone who is such an advocate for mental health for everyone to address these issues and go to therapy,
Mm-hmm.
utilizing this space, how is the best way we can encourage men that they are not losing their masculinity and in fact gaining
Mm-hmm.
emotional intelligence and emotional vulnerability to become like a better version of this man that they want to be? How can we use this
Mm-hmm.
space to encourage that?
By this space, what do you mean by this space?
Like on this podcast, if I am encouraged, somebody's listening to this and they're like, yes, this is all true.
Yeah.
This is how I feel.
Yes.
How is someone like me, or say the women who are listening and their partner or their
Yeah.
brother or their family member, how can they make it a space for that person in their life to be to show them that they can have both? Because they have been taught,
Yeah.
unlearning these things is part of that. But how can people in these men's lives help them to
Yeah.
understand that better?
Well, I think part of what happens is that I do believe therapy as a resource or like coaching, even. I feel like I know a lot of men's coaches who do essentially what I do in therapy, but there's a branding shift, which I think can be a little bit more accessible for some men. But I do think even therapy is becoming a less stigmatized resource. And even in some places in the country, almost like a status symbol. Like, oh yeah, I've got the best therapist in New York, right? Like, oh, like you're in LA, like, yeah, I'm gonna go see my therapist. Like there are places where I see that shift happening. And I think especially versus for that, I do see that shifting a bit. I think what we can do generally, like general population can do, is in our own homes and with our own relationships with men. What I think, what I hear from a lot of men is that before they're even considering going to therapy, they're gauging in their own life. Is there space for me to be emotional? Is there space for me to be vulnerable? And what happens when I do take up that space? What happens when I do allow myself to be vulnerable? I open up, I cry, I share that I'm struggling, I share that I'm hurting, I share that I'm worried, I'm scared. And what happens, what I hear happen, and this again, generally, this is not everyone, but at all, but I think the men who are especially reluctant to therapy is that in their own lives, they're experiencing what happens when they are vulnerable and emotional, and it's completely turning them off. So they're feeling like, okay, I opened up to my spouse, I opened up to my girlfriend, or I opened up to my friends, and they shut me down, or they laughed it off, or they dismissed me, or I told her how I was feeling, and she seemed okay. Maybe she seemed a little uncomfortable in the moment that I cried, and then 3 weeks later, we got into a fight, and she turned it against me, and she threw it in my face. And so I think that unfortunately, we are all unlearning a lot of these stereotypes, women included, are unlearning what it looks like for a man to be a man and what our expectations are and what we want and how we reconcile those differences. Like if we're wanting men to shift, then we're also having to recognize like, oh, my expectations then and what I've been socialized to expect needs to shift. So when my husband, say, for example, is sharing things he's going through, I have to work. I'm a therapist for men, and I have to work on not getting defensive, being really open and receptive, right? Like not jumping to like, well, that's a thought. That's not a feeling. Like it's not going
Mm-hmm.
to be perfect. Like if men are trying something new and it's something that we haven't really taught them how to do, like women are taught to feel a lot of other emotions. And don't get me wrong, women don't have this like free ride on emotions. Like men get a ton of permission for anger. Women don't get a ton of permission for anger. So like there are pros and cons for sure. But if from a young age men are told like don't be weak, don't cry, be a man, when they're 30 years old, 40 years old, and they're like, okay, let me try to be emotional with my wife, like it's probably going to be a little clunky. Like it's not going to be a flawless, emotionally intelligent, like perfect execution of
Hmm.
vulnerability. And so I think just in our day-to-day lives, the amount of compassion and grace and permission we can offer to the men in our lives to be messy is what I often call it with my clients. Like show up and be messy, right? Like take that mask off. Like it's exhausting. Let yourself just be. And if we in our everyday lives can create more space for men to do that in a safe manner, then I think the next step towards therapy and having someone who's unbiased and an expert and specialized to help them actually like change and grow is an easier step to take because they've had the experiences already in their life that say, okay, I can take this risk and it won't come back and bite me.
Mm. Yeah. Gosh, it's so hard, right? We're all constantly unlearning things, but two, I think this is why awareness and advocacy is so important because all the women who do listen to this, along with the men, we can start to understand each other just a little bit better. It's like bridging that gap of, hey, we're all trying to work through this together and let's have a little space for each other. It's so important. I am curious and totally, I'm not sure if you have any experience with this, but given where we are in just this kind of state of men wanting to go to therapy, but not really. Do you see this correlation in dating for men where they just kind of stop dating because they're like, I don't want to do this. I don't want to go to therapy and go through all this. And then I had these experiences with women and now I'm shutting down. Do you see that correlation happening at all? I don't know. This is more of a curiosity question.
Yeah, I do. I see that in my private practice, and I see that expressed a lot on social media. Um, and granted, like the reactions I get from people who follow me or engage, oftentimes polarized experiences, but are a lot of men who feel discouraged, who feel kind of hopeless, and who just honestly, I think a lot of us feel tired. It's this is hard work that we are all investing in, and it's hard enough on our own. It's even harder when you add a relationship into it and you're like, God, now we've both got our baggage and our messes and we're trying to fix it and we're trying to heal together and like this is just so complicated. And so I feel like a lot of men that are engaging with my content especially are feeling tired and feeling discouraged. Those are the loud voices. Those are the ones that speak up, you know, and want to be heard and they deserve to be. And I think what is a really beautiful thing that's happened on social media for me is having so many different voices, so many different men's voices that come in, and even men who are saying, like, no, this has been worth it. And you know, I had partners in the past where you're right, like they weren't open to my vulnerability and my emotionality. But the reality is, like, I was in a more stoic sort of shut down place when I met them. So I was attracting someone who was okay with me not putting myself out there. And when I tried to put myself out there, I felt rejected. But like, this was the partner I attracted. This is the partner maybe I even subconsciously sought out. And so then the beautiful thing is having so many men who are actively engaging in like the comments of some of my videos saying like, no, this is worth it. Like you guys deserve it. Like give it a shot, give yourself a shot. Like you're worth this. The relationships that are more supportive and like want this from you are out there. And so although I do think there is a collective exhaustion and like fatigue around personal growth, because it is hard work, I also think there are a lot of men out there who are seeing through to the other side of that and are courageously speaking up in favor of that experience.
It's so interesting that you say this and share this because I've seen this across the board and I wanted you to speak kind of in that male perspective because it is, you know, it's also heavily on social media. Women are more comfortable with their feelings and they're more comfortable sharing their experiences with dating. And it's not as common that you see guys sharing it.
Yeah.
So, uh, you know, I wanted it to be from this perspective that we're all just kind of exhausted. And I was hopeful that at least we're all feeling that way instead of it being this one-sided,
Yeah.
experience of life. You assume that and you hope that, but to I think get the validation that that's happening maybe can help everybody feel a little bit better.
Yes, I think that there are more similarities than differences. There are people who are just exhausted but still trying. There are people who are fed up and saying, I'm done. There are people who are just like so determined and hopeful and will keep just like gritting their teeth and fighting through until they find what they know they deserve. But what I hear from men overwhelmingly, like what I've seen, like the beautiful thing that I've seen, especially on social media, is so many men taking the risk to speak to their desires for growth and their commitment to themselves and their self-awareness that, maybe I actually did kind of have a shitty childhood and I've brushed it off and pretended like everything was fine, but like maybe I've locked everything up for 40 years and it actually still affects me. And maybe I do deserve to do something about that. And I think being able to, like, I give a lot of credit for the men who are willing to speak up about those experiences because I think what's even more impactful is the men who are then able to witness that. And
Mm.
it's not everyone who's going to jump into the comments on social media and share their story, but it is a lot of people who are witnessing that and maybe liking a comment or saving a post. And I think that impact, the reach of that goes beyond like what we could ever imagine. And I'm hopeful about like where that's headed. I feel very invested in that because I feel this trending in a really positive direction.
Oh, I love to hear that. I love knowing that we're just constantly changing and evolving. There's also, I think, a little bit to therapy, and as we start to get older, I know even women feel this way, and maybe men do as well, where it's just too late. I've been this way my whole life. It's
Yes.
fine.
Yep.
Like, you can't fix
Yeah.
this. There's too much here.
Yeah. Yep.
Can you speak to that? Because I know that that is not true. And I know that you can be any age
Yes.
and unlearn and go through things. But coming
Yes.
from you, I think it will be important to hear.
Yes. Yes, that is just like overwhelmingly untrue. I and I don't just believe that because I am in the field and the business of people seeking out therapy. Like I am committed to this work because I care about what I do and I have witnessed the change that can occur. And I've had men start therapy with me in their 70s, having never been to therapy before. You gather a lot of life experiences, you could absolutely just put it in neutral and coast. But I have seen the incredible exponential change that can happen at any point in someone's life when they decide now's the time. And I understand the the I can understand why there may feel like you may feel defeated. I can understand why you may feel defeated and say like no, it's too late, right? Like the clock has been ticking for a while. And I can also understand feeling regretful. Like, well, okay, I'm going to go change now. And then the rest of like all my life up until this point is going to feel like a waste. Or I even see men sometimes struggle with that when they do make those big changes. Like, God, why didn't I do this sooner? And I see men do that at 25. I see them do that at 65, right? Like, God, why didn't I do this sooner? And what I always say is like, yep, I too wish you'd been here years ago. And I'm really glad you're here now. And now you get the rest of your life. And I think that's a really powerful thing that we can experience at any point in our life is realizing the moment where things are always going to be different. Like where we now get to live the rest of our life with a completely shifted perspective. And like, that's magical. I don't care how old you are. And if part of that is going to be, wow, I saw it a certain way then and my perspective shifted. And you can look at the past and feel regretful of that or guilty that you didn't do more. Like you can have a lot and grieve that loss, right? Like those emotions are valid. And it is so powerful at any point in your life to be able to say, and now I know differently. And now that I know better, I can do better. I think that's Maya Angelou. Like that is huge. And I think if you get 6 more months out of life being able to do better, feel better, be better, then I think we're worth it.
Oh yeah, that was really good. And the quote they're throwing in was just chef's kiss. It's so good to hear that. Again, I knew all of this, but I think it's important for people to hear, particularly men, to just understand that it's worth it, even when it's hard and it seems a little crazy to be going back and reliving some of these hard times in our
Yes.
lives. What is something that
Yes.
you have seen working with so many men and in men's mental health and just in the field in general, where you're kind of like, oh, wow, I didn't see this being part of this. Like, is there anything that was so unexpected? And this is kind of a broad, it could be anything, but particularly with men that you're like, dang, I wish people realized this more or knew about this because this is such a big thing.
I I think, I mean, the thing that stands out to me, and I think it stands out because it happens a lot now, and it is also to me like has made me just understand my work with eyes wide open, is the number of men that I work with who start therapy maybe in their, I see a lot of men like kind of middle-ish, early-ish 30s, 40s, 50s, oftentimes starting therapy. And it's usually because they've exhausted all other resources. They've been to urgent care 14 times with, a heart attack, a panic attack. They've tried acupuncture. They've gone to a life coach. They've done every diet or weightlifting regimen you could try. They've tried everything, and they're with me because they're like, I finally somebody in their life or some sort of expert provider, medical provider was like, maybe try therapy, right? And they're reluctantly with me. And they come in, and the story is often like, I've never struggled like that. I've never been anxious. I haven't been depressed. Like I've been fine until recently. And what I often help clients do is, I'm not here to just like dig into your childhood and your history for the hell of it. Like I'm not trying to make a mess. Like I want to help my clients understand the why. Like let's understand what's going on for you and what's not working. But let's understand that like that was probably born out of something like really protective and adaptive. Like you're frustrated with yourself for these patterns now. They started from a place of you just like doing your best. So let's understand why you started that. Let's like dig into what was going on for you, where you had to start losing yourself in work, or you started drinking a lot, or you withdrew from your friends, or whatever it might be that you learned, you coped a certain way. And so many of these men then they retrace their steps, and you get a little bit more perspective when you've got a therapist there supporting you through this exploration and able to say, oh, like that was impactful. That did hurt. Like that was tough. Things did really change at that, whether it was my family moved suddenly across the country, or I had an injury and my athletic career ended suddenly, or I had a loss of a loved one, whatever it might be. There's these significant events. And so many of these men I watch realize that they were naturally really sensitive kids. They were they were emotional. Like studies show baby boys are more emotional than baby girls. Like little boys are naturally more emotionally expressive, and it is quickly by the age of like 4 or 5 socialized out of them. Just the way that parents interact with them, the way we treat little boys. And so many of these men realize like, oh no, I was really sensitive. And usually the way they start saying that is like, oh yeah, I was crybaby, or I was a mama's boy, or I got picked on, or whatever that might be. But to be able to help my clients, and I hope that I do this too, and the men that I reach on social media recognize that like that sensitivity, like that emotion is so core and innate to who you are. And like that's a superpower. Like you have been that's been conditioned out of you over the years. So now you feel like you're emotionally numb, or you're emotionally illiterate. Like you feel like I don't know how to connect emotionally. Okay, now that's how you feel. But I think what has been, beautifully surprising to me is, I'm not trying to make men more emotional for the sake of making men emotional. I want to help men feel more connected with their true self. Like, who are you at your core? Who are you authentically? And like, when you strip back these masks and you feel like you are truly showing up and being yourself, who is that? And so many of these men are incredibly sensitive, but they did not get the support or the education or the encouragement to really lean into that, like a lot of women are, right? Like I become a therapist because I was celebrated for my empathy and my interpersonal skills, and like I leaned into that. think a lot of men don't become therapists because they weren't necessarily encouraged in that sort of helping direction. But so many of these men, so many of you, if you're listening, men, are you peel back those layers, like who were you then? And what would it be like if maybe you're not gonna be the same emotional 4-year-old you were then. But what if you were just a little bit more in touch with that little kid? Then do you have a bit more access to that emotion? Right? Like that little kid, for whatever reason, learned I've got to set this aside to survive.
Mm.
But now, as an adult, as you have a little bit more autonomy, hopefully some safety in your relationships, like permission, can you give yourself more permission to be a little bit more in touch with that like emotional core version of you? And that is like one of the most amazing things I watch what men do that like that I'm able to witness is like that transformation of like I said, kind of like working towards a place of more alignment to not have to, I think any of us can appreciate like when we're able to show up and be more authentically ourselves and to feel like, oh, now like I belong, like I don't have to just work so hard to fit in. Like I belong here. Like
Mm.
I feel right in this space. Like I feel connected to people. And when I'm able to, support men in getting there that in a way that makes them just like feel more whole is like my job. I have the best job in the world. Like it's amazing what I get to do. But that experience is one that I see all the time. Men who in their adult mature lives are like very emotionally buttoned up. But like you peel back those layers and there's a really sensitive kid somewhere inside.
Wow, that's so interesting in how you shared that, but also I never knew that just about like little boys versus little girls and how that transpires. And that's even crazy just me sitting here with this perspective that I never knew that, right? Like I'm existing out in the world and thinking that there's just all these men out here that are just deeply not sensitive. And I'm like, what is
Yep.
happening? What? Just feel
Yep.
something, please, anything. And
Yeah.
it makes so much sense that you say it in that way because not only did they go through things in similar capacities that women are also experiencing, right? We all have moments in our life that impact us, but
Yeah.
that they also had to button up so quickly at such a young age
Yeah.
that naturally trying to get that version of themselves back again is going to take so much effort and time and unlearning. And that's hard. That requires a lot of effort and a lot of vulnerability that they are also been taught you can't have. So they're
Right.
fighting
It's a
against
trap,
just,
right? Like
yeah, they're fighting against so many
it's a
different
trap.
things. Yes, either which way they go,
Yes.
it's
And then
bad
we're
for
saying
them.
like, well, go to therapy. Yeah, but go to therapy. Like, go work on it in therapy. They're like, okay, let me search for a therapist. They're like, well, none of these therapists want to work with me, right? Like, they don't feel safe. And that was why it was like a top priority for me when I started my own practice was like my space. Like, don't get me wrong, it's got a vibe, like it's got a great feminine touch to it, but like it is a lot of leather, it is a lot of dark tones, like it's not inspirational quotes on the wall. I have Teddy Roosevelt's man in the arena quote on the wall. If you don't know it
Great
already,
quote.
like it's a
Great
great one to
quote.
look into.
Mm-hmm.
Yes.
Mm-hmm.
And so like that's in my waiting room. Like a man comes in, he sits in a comfortable chair in a space that feels welcoming, and like that's what he sees. And being able to like from the moment you see me on whether it be social media or on my website, you walk into my office, the way I'm interacting with you and talking to you, like it's an inclusive, welcoming experience for men. And if I believe, regardless of gender, regardless of personal experiences and identity, we all deserve inclusive spaces. We all deserve therapy that feels like it is catering to us, that knows us, right? Like I wouldn't walk into a therapist's office if I sat down and be like, oh God, like, oh, I don't really work with women. I'd be like, well, get me the hell out of here. Like, how are you
Yep.
supposed to help me? But we're asking men to do that, unfortunately. And so I have like kind of made it my own mission that in addition to sort of like advocating for the work that I do and men's mental health online is also I work really hard to challenge other therapists to like get their shit together. Like I I I I say jokingly, like with the clients I work with, like I call men in, I don't call them out. Like I want to have conversations with you, not at you. But I will be honest, like I call therapists out. Like I will throw some punches because I think it's necessary for us to wake up and realize like if we are in the business of helping, then that should mean that we are very aware of our own biases. We're very aware of what we're doing, and we're very aware of the fact that we may be like limiting half of the population from feeling like they're welcome in our offices. And so that's a strong push that I feel very passionate about now is challenging my peers to do better. Because I know, just like me, for 8 years, 10 years before I started my practice, I was doing this work behind the scenes, but it was nowhere in my online bio or on my the group practice I worked for, the website, was it like specialized in therapy for men. People I knew just knew, okay, if we get these clients coming through our doors, let's refer them to Audra. It's so important though for us therapists as professionals, for helping professionals to be very clear about men being welcome in the space if they are welcome in our space. I, over the last few months, even put together a directory of therapists for men that I have. It's free for therapists to join who feel passionate about this work and want to create a safe space for men. And I share it. I haven't just like handed it out like free candy on social media to men. Like it's linked in my LinkedIn bio. I hand it out whenever I get a DM asking for resources. And it's a lot of therapists across the US, but Canada and actually worldwide. Because unfortunately, like there's not many like there are not really many spaces online or anywhere where you can find like here's a list of like a bunch of providers who might feel safe for me. Here are a bunch of options. And so I feel just like so dedicated to not just making my practice with like the 20 clients I can see a week inclusive, but seeing how I can help branch this out. Like, how can I, as a therapist, you can only see so many hours of clients in a week, and I can't offer therapy online to the masses. And so I feel like if I can do something to help other therapists, like step forward and say, like I have, and I'll be honest, like it did feel like a bit of a risk as a woman to be like, yeah, I'm a therapist for men. Like
Hmm.
even my husband was like, really? Like we're gonna go with that? Like we're gonna do that? And I was like, this is what I love. Like this is what I do. Um, if I'm this is the work I want to do. This is the work you have to say that you're doing. And it did feel like a bit of a risk, right? To step forward as an expert in anything. I think you can feel that imposter syndrome, but it's so important because that what I've noticed is that when you do step up and you say, I'm here to help and I work with men and here's what I stand by. I, there are so many men who want to be in therapy and aren't because they don't believe that there's a therapist there for them. They don't believe that space is a safe space. So I really charge therapists to, we can't fault men for not going to therapy unless we're first and also faulting therapists for not making therapy an inclusive space for men.
Oh, wow. I love what you're doing so much, especially coming from my perspective. I love what you are doing to help all of our guy friends out there in the world and family members. I think there are so many people out there who want this
Yep.
for them. So I just appreciate you coming on, taking the time to do this, but not only your specialization in what you're doing, but the advocacy that you're also doing outside of your job and your specialty. I think it's really cool and awesome. So just props to you, but also thank you for coming on and
Thank
sharing all of
you.
this.
Yeah, I'm so grateful to be able to talk to you about this. I appreciate the work you're doing to spread this message and to share your message and your experiences and to normalize this and just create even more spaces to have these get, the better we all are. And I think that goes across the board. Like the healthier we all are, the better it benefits everybody else around us. So thank you so much for inviting me and like letting me share some of this, to hopefully reach more people. Like that's my number one objective is to get this information out there to the men who need it because the statistics on male suicide are really staggering. They're very, very overwhelmingly scary. And if we're not stepping up to do more to address that, then all we're doing is standing with our jaw open at a statistic. And these are family tragedies. These are not just numbers, these are family tragedies. And so I think the more that we can do to get this message out that there is support for men who need it, the better.
Absolutely. I lost one of my dear friends to suicide when I was in high school, like outside of high school, and it still to this day wrecks me because I wish that the resources were there for him, and I wish we were able to help in more ways. So that is part of my mission in general, is
Hmm.
just across the board for people to feel comfortable to get the help that they want to get. And I want it to be commonplace for us to have conversations, not just about mental health, but about depression and anxiety and
Yes,
suicide and everything for every gender, for every person. So I really,
agreed.
really appreciate everything you are doing. So thank you. And thank you for coming on.
Thank you so much. It was great to be here.